My name is Amy Frazier, and I'm here for an ablation surgery for a cardiac twin.
And I'm George Frazier, and I'm here with my wife for the surgery.
I know the procedure that I'm having is called an ablation for an cardiac twin. Originally, the twin was supposed to vanish, but unfortunately, it grew its own little umbilical cord and kind of like continued into a mass. We have one healthy baby. I know that they're gonna go in and just kind of cauterize the connection just so that the healthy baby discontinues pumping double and doesn't go into cardiac arrest. We're hoping for the best outcome, and I think that we have a good team behind us here with the surgeons and the nurses, and we're taking it as it comes.
You have this perfect idea in your head when you're getting ready to have children. You don't have a baby to anticipate that they're going to be sick or that they're going to be in the NICU.
In the mornings before my day starts, I always pray because you just never know what's going to walk in the door.
If you don't stay focused, there's no way for you to coordinate and think about what's going to happen next. The atmosphere on the floor can be very hectic, but at the same time, we're here to make sure our patients enjoy the best moment of their life, having their babies. We're gonna go ahead and get started. Any shout outs?
I want to give a shout out to Crystal, who helped me last night with my patients when I was delivering. She made sure that I was able to get all the stuff that I needed.
Great.
Give a shout out to my baby nurse right here, Mary.
Thank you.
Yes.
I would like to give a shout out to Jerusalem, who assisted me in the OR.
Awesome.
I really appreciated her. Thank you, Jerusalem.
Great. So I'm gonna go ahead and give you guys the assignments. Jackie and Danielle, OR, Laura, Iggy, transition, Brittany and Lily, recovery. I try to assign the nurses to the patients that need them the most. You have the Spanish speakers with the Spanish patients. Communication is very important in patient care. So it's very nice when your nurse has an idea of your culture and can communicate in your language.
¿Cómo estás? ¿Cómo te sientes? My current patient, she's 25 years old. This is her first pregnancy ever, which we call G1P0. She's here with her partner. He's very, very supportive. They're very excited to have their first baby.
Yo en mi cabeza nunca pensé que podría estar embarazada realmente porque mi pareja se supone que no podía procrear hijos. Y fue un milagro.
Gracias a Dios.
So the challenges that this patient currently has is that her family is not in the United States. They are from Nicaragua and Costa Rica, so not having that support system is very challenging for them. She's 1 centimeter dilated. She needs to get up to 10 to be able to deliver. So once the cook balloon comes out, she'll be approximately 3 to 4 centimeters dilated. After that, usually the plan is to break her water as long as baby's head is well engaged in her pelvis.
They came to the States about a year ago. I remember when I introduced myself, she was a little timid, and then that's when I asked her, what language do you speak? And she said she speaks Haitian Creole. I said, oh, perfect. I'm Haitian, I speak Creole. And it's like her eyes just like lit up. Que je l'appelle, mami?
Chloe.
Oh, elle a un bel tino.
Chloe? Chloe?
Bel tino. Is the Pitocin still going? Yes, it's currently at 10. Where I was able to create a rapport and get her as comfortable as possible. Her first pregnancy was kind of tough because she was young in Haiti, and I remember her telling me she delivered her baby on the streets. The doctor said, hey, go for a walk and things like that. And then when she went for a walk, it was time, and she literally pushed her baby out in the streets. Okay. Combien centímetros d'altura você tem? It's like, okay, vai marcher. Okay. The best part about it is being there for the parents, because sometimes they're alone, and especially in the Haitian culture, they're alone. They don't have anybody. I reassure them and tell them, like, hey, I'm with you. Like, it's gonna be okay. Like, I'm gonna hold your hand. And they thank me and they say, God bless you. You're an amazing nurse. And that's what warms my heart.
I don't know why it is, but it is 100%. Every time there's a full moon, everything is crazy. The OR, the labor floor, triage.
Let me check with Christina.
In a typical day, we have patients rushing in because they waited too long at home and now their baby's coming, so we need to rush them in. On that day, we had 2 what we call stat OBs, that the moms come in and their babies are delivering very fast.
That's where the action happened.
Yes, it was a stat OB. Laboranddelivery, Christina, how may I help you?
Can you post it for C-section 41?
Thank you so much. The nice will call you when she has a moment.
Yeah.
Okay.
It's just... Oh, okay, I'll let the doctors know.
Baby out. That mom just had a beautiful baby girl. She presented to us in very active labor. So her labor was very quick and it was unmedicated. That's why you heard those beautiful sounds. She is now holding a beautiful baby girl in her arms.
When we have a situation when we have very sick babies, usually we know during their prenatal care and we coordinate with their obstetrician and the team in the hospital. We try to do what we call a multidisciplinary meeting way ahead of time so that we can be ready when the patient comes in for her delivery.
Mi nombre es Hazel Martínez. Venimos desde Honduras buscando atención médica porque tenemos un embarazo muy complicado.
She was a very high-risk pregnancy. She's remained in our antepartum unit for a couple of weeks before she had to be delivered. She was pregnant with triplets.
Lamentablemente una de ellas falleció por una malformación cromosómica y quedaron 2 bebés con vida.
And that day, the babies weren't doing too well and they had to be delivered. She was an emergency C-section. Right before the delivery, once the mom is ready to have her baby, we call everybody that should be involved. With twin deliveries, we have 3 teams, 1 team for each baby, and we have 1 team for mom's care. Fortunately, we're able to successfully deliver her other 2 babies.
Maternal fetal medicine has advanced a lot in the last several decades. We are taking care of the tiniest of the babies to the most complex babies, and we need expertise from all sides, from OBGYN, from nursing, from respiratory therapists.
That will attend the delivery as well with us so that they can receive the baby and they can start providing care as soon as the baby comes out.
It's a teamwork. Everyone has to come together as a team to make sure that we provide the best care to our babies.
Once the emergency C-section was called, we make an announcement over the radio and alert our high-risk team for the NICU so we can coordinate the care.
No existe en nuestro país este tipo de oportunidades. El pronóstico de nuestras bebés en Honduras era la muerte. Desde las 23 semanas tenemos de estar escuchando que las bebés morirían, que mi esposa iba a morir si no la sacaban, porque la alternativa para ellos era sacar las bebés para que mi esposa viviera. O sea, tenía que entregar la vida de mis hijas para tener la vida de mi esposa. Y aquí fue otro panorama.
My name is Olive Fowler. This is the newborn intensive care unit. I've been working here for 30 years and 2 months to be exact.
So good morning, everyone. Thank you all for coming to work. We certainly appreciate all that you do each and every day. For our census this morning, we have a total of 65 babies, and we're fully staffed this morning. And we have a set of twins yesterday, which they're doing very good. So thanks again to all the team that was here yesterday who participated in the delivery process, and we continue to do well.
We're the largest neonatal intensive care unit here in Florida. We are 126 beds. Level 4 means that you are able to give special cares that like a level 2 or level 1 NICU is not able to give.
So over here we have our NICU A, which is our most critical area. So we'll have babies here from 22 to even full-term babies. I would say each unit has a different goal. I would say respiratory status is a main goal in NICU A. As the babies progress to NICU B, we're transitioning the babies from being on oxygen to working on bottle feeding, educating the parents on how to do everyday activities such as giving baths, how to wrap the babies, everything that they need to know to have a healthy baby once the baby comes home.
We have a very large transport team that transport people in from overseas as well as local hospitals, cases that they're not able to take care of are being transported here to our NICU.
We see things here that you probably would read in a textbook. Most times when a baby comes in, we have an idea of what's happening with this baby. Once labor and delivery notifies us that a mother is in distress or something is going on, whoever is the admission for that day, they know to prepare. So they'll make sure that their bed is ready for the baby. Everything that they need is ready for the baby. The nurse practitioner, the physician, the respiratory therapist, everybody goes to the OR and they get the baby, bring the baby back to us, and then we start getting the baby together. Starting IVs, whatever is needed at that time, that's what we will do. It's very structured, and I like that.
You have to be well trained in order to work in this NICU. On a daily basis, we see babies anyway from 22 weeks and some days. We save those all the way up. Patient with respiratory problem, cardiac problem, GI problem, metabolic problem, different treatment modalities we have here. I've seen it all. Shout out to Alicia, Lily. Where's Lily? Lily's here today. Lily Hunter, and Ashley Koch and Brittany Anderson for the wonderful work they did with that baby. And that mom wrote that beautiful letter, and I read it in staff meeting last week. For those of you who weren't here, I have it, and I'll give them a copy each so they can have it in their file. Is there any shout out? Somebody would like to shout out to their coworker? Yes, ma'am.
So I want to shout out Lucia, Anna, Alice, and Isa. So we had a mom who abrupted on Friday, and everyone just stepped in. It was a full code experience, and they, helped my other patients as well. So thank you.
Round of applause. Thank you very much. You want to share a secret with the guys? This young lady, we both came here together, the same hospital orientation.
And we're still here.
We still here together. We came the same day, sorry, the same day here at Jackson.
And I'm waiting for her. She's a good boss.
In the NICU, we all just fit like a glove. Like, we are a family.
We all are very different in the way that we react to certain situations.
Yes.
But at the end of the day, I feel like, from my experience being here, we've all pulled through at the end of the day.
When times get rough, and sometimes it does, I say a little prayer. Sometimes I'll step away, I'll go to the bathroom and try to get it together and come back and be there for the family.
Sometimes that's all they need is just for you to hug them, and just, like she said, empathize with them,
The NICU is a lot emotionally and mentally. This NICU here it's a team, more like a family. If something is going on, your teammates are going to be there to kind of help you through that day, through that moment.
The kind of nurse that work in this unit, the nurses who are passionate, have to be caring, they have to be show compassion.
A good nurse, you have to be able to relate to your patients. You don't want to see another parent go through some of the things that those parents are going through, but I can imagine as a parent how they would feel. I'm getting emotional now. Hold on, we're not doing that. Wait a minute. And so to control the emotion, I don't know, if they cry, I'm gonna cry. Like, it's just really simple.
Sometimes, depending on what's going on for your day, you do carry it, even though you try to leave it at the door, but you do carry it with you. It's more like my daughter, I think, that has a hard time. She's a little bit older now, but I know when she was younger, I would walk in and get back what I call the mommy mode. I said, let mommy get back to mommy mode. So I could, relieve everything that I did at work and try to get back to being mommy and a wife.
I enjoy being able to basically connect with my parents, just letting them know that it is okay, that, the baby's here, and now all we can do is just make sure that we are doing what we're supposed to do to make sure that baby's gonna stay. As I explained to them, it's a moment at a time, not a day, not an hour. It's literally a moment at a time when you're working with a NICU baby.
And this is the type of nurses that we have working in this unit. Everyone treats these babies as if it's their own family baby or it's their own baby. And this is the only way you can survive working in this NICU, because very, very sick babies come through this area.
Once I got introduced to the NICU, that was it. When I came and I saw the babies, how they were, I saw the parents, my heart went out. And that's when I decided, I should be able to make a difference, and that was it. It was just love.
Yeah, no, I'm okay. I just get emotional when I talk about my babies. That's all. The number one employee is my son, Nathan. He's 5 and he never slows down, but he takes care of me just as much as I take care of him. He was hoping for a baby brother from the start, and then he started calling it baby sister for a little while, but we just found out maybe like 4 days ago that we were having a boy, so we let him do the whole bite into the cupcake, see the blue, and he was very excited.
My name is Rodrigo Ruano. I'm the chief of the maternal fetal medicine division and the director of the fetal center. I'm a fetal surgeon, and then I deal with some complex cases, sometimes very high-risk pregnancies. Now we just did like a monochorionic, one placenta with 2 amniotic cavities, and then one of the twins did not develop well. So we had a cardiac mass that was stealing blood from the other twin, and the other twin was getting sick. So we decided to stop that mass, and then the other fetus can do well. We can perform those procedures since 16 weeks until 26 weeks, more or less. The objective here is to perform the procedure as soon as we diagnose to prevent complications. One of the complications is in this situation when you have one normal twin attached to a cardiac mass that is stealing blood from this normal fetus, is that the heart can fail and we can lose the baby.
He's actually going to be George Fraser the 6th, so he'll be G6 for short, and hopefully he will carry on the Fraser name as proudly as his dad and his grandparents do, and we can't wait. G6, since the day one, we've been doing things to our best ability to keep you healthy and safe, and we can't wait to meet you and just love on you physically.
Mom and Daddy always got your back no matter what. This Mom and Daddy got every step of the way. We'll always be here for you, just to make sure we got your back to help you push through things that you don't think you can get through yourself.
Devo caminhar grande et no bagazza dividono osine university.
She said that she would want her daughter to become a huge doctor, but the dad says no. He's scared of blood and he doesn't want the daughter to do anything with blood. So she wants the daughter to be a professor in a university.
Respire. Respire, mami. Empuje. Puse. Push. Okay, respire. Big breath in. Puse, mommy. Puse. Come on, push. Yes. 5, 6, 7, 8, 9. As a transitional nurse, we are at bedside during delivery. As long as baby is okay, healthy, baby stays with mom at all times. So we do the assessment at bedside, we give medications at bedside, we encourage breastfeeding. So we assist moms with the breastfeeding. We also have a lactation consultant who's very great and educates the mom as well.
My favorite thing about what I do is when I see moms being sent home with their baby in their arms. As an associate nurse manager, I am not part of the delivery team too often. I miss being at bedside a lot. Sometimes I'll actually just go into the delivery just for the sake of attending a delivery.
She delivered at like 4 p.m. and I was already home. But the good thing about it is when I came back that night, she was still in the room and she was so excited to see me. And I was able to see the baby, beautiful baby girl named Chloe.
Ok, mamita, so esta es la bola que le dicen el maní, en inglés peanut ball. So escoge cualquiera de tus lados que quieras estar acostada. Okay. Entonces cada 30 minutos te viramos de lado a lado. Okay. Voy a bajar la parte de atrás de la cama, okay? This patient had plans on delivering vaginally. The doctors broke her water. We had given her Pitocin to help strengthen her contractions. We had repositioned her side to side, hands and knees, but she was just not dilating. The patient was very positive with everything that was going on. She was very faithful that it would still work out, but she also had an understanding that if it didn't work out and she'll end up in a C-section, what really mattered the most was that she was okay and baby was okay at the end. I told her it was okay. You know, the important thing was that baby was safe, she was in good hands. Her partner was also very accepting. He was very supportive with her. He would help her reposition, give her water. He was one of our employees. Just kidding. Some dads are just afraid. They don't know what to do, like what's expected of them to do. But this dad was amazing. He was just very involved. She did not dilate past 5 centimeters.
Time out. We have Miss Alba Rosa Urbina Biomed. She has no medical allergies on file. She's a primary C-section called urgent for failed induction. She S-formed over 24 hours ago as of 1750. Do we all agree? Agree. Baby's up.
Baby out.
Should have been infused. Yeah, I pulled out 92 C's probably.
Do we want gases?
Yeah.
Okay.
Pasé tanta preocupación, pero a la hora de ver el milagro que en sí salió bien mi hijo, que lo vi por primera vez, sentí, se me olvidó todo lo que he pasado y gracias a Dios por este regalo tan hermoso que... Imagínate, mira, me tiembla todo, no puedo ni contenerme de pie y bueno, creo que la mejor experiencia para ella también.
She was in love with her baby, saying how beautiful the baby was. The baby was small for gestational age, so went to the NICU for further monitoring.
Que se prepare porque voy a tratar de dar lo mejor de mí para darle un futuro mejor. Creo que estamos en el mejor país para lograr cumplirle el sueño y darle lo mejor a él y que, bueno, primeramente Dios voy a tratar de darle lo mejor que pueda.
All right, Daddy. You understand what I'm saying, though, right, Daddy? Yeah. Okay, I'm just making sure. So, as I mentioned to you before, they may go ahead and start feeding her tomorrow. Today we're going to do what is called milk drops, so to speak. And so it's like 1 ml that they're giving her just to kind of like get her gut to start moving along because the peristalsis is nothing right now, right? Mm-hmm. So we want her belly to start kind of working, so that's what we're gonna do. So I would prefer if we could get the breast milk. I like that better only because it helps mommy to start pumping and get the milk flowing, right? So Kate, you have any questions for me?
No, right now, no.
No? I know it's a lot to take in. It's a lot.
Los nombres de mis hijas son Hannah y Beth, la más grandecita que pesó 1,350 gramos y la más pequeñita se llama Hazel Esther y pesa 940 gramos. Mi esposa está con vida, está estable, está muy bien, se recuperó completamente, no tiene ninguna complicación.
As a leader for this floor, it is challenging at times, but you have to be positive. We do have our ups and downs at times, but look at the positive, look at the brighter side, look at who we're caring for, these tiny tots.
In the NICU, when you're taking care of someone's precious cargo, you see that they're grateful for the fact that you are helping to make sure that their child is better.
So these are all the notes that the families have sent us after, their first-year birthday or second-year birthday or Christmas cards. And so we really just love reading their messages and, getting to see where they've come from.
And we also have the annual NICU party in December, and all these babies come back. We also get grown kids, 20-something that comes back. They're in college. When you see them, you can't believe they're valedictorian,
from even way before when I started here. These are blankets of kids that have been here in the NICU. So parents will write little messages to us, you know, mementos, their footprints, prayers. So every day when I walk into work, I always stop and look at these blankets because I truly can see the difference we're making, you know, in this world.
It's a labor of love because you have to love what you're doing.
I just love labor. It's just one of the happiest moments in a woman's life.
What I love about it is that I'm able to be a part of a special, memorable moment and share that moment with the parents. I love that.
If you don't like people, this is not the job for you. You cannot do this job solely for the paycheck. You come into work, you're getting out of your bed every single day to take care of someone else's family. You have to love what you're doing.